Campylo means curved, bacter means rod, while jejuni refers to the jejunum, which is a segment of the small intestine found between the duodenum and the ileum. So Campylobacter jejuni is a comma-shaped bacteria, and it's one of the most common causes of bacterial gastroenteritis worldwide. It's commonly found in foods like poultry and unpasteurized milk. Now let's talk microbe anatomy and physiology. Campylobacter jejuni is a comma-shaped bacteria that has a thin peptidoglycan cell wall, which doesn't take in the purple dye when gram-stained and instead appears pink or red, which makes it a gram-negative bacteria. It also has a flagellum at one end which it uses to get around, so it's a motile bacteria. In addition to this, it's oxidase positive, meaning that it can use oxygen to create stored energy or ATP. Lastly, Campylobacter jejuni is a microaerophile that loves warmth, so it grows best in low oxygen environments at 42 degrees Celsius on blood agar varieties like Skiro, Butzler, and Campylobacter. Alright, Campylobacter jejuni is usually transmitted from animals to humans via the fecal-oral route. In other words, you catch it by ingesting stool particles containing the bacteria. Campylobacter jejuni usually resides in the gastrointestinal tract of birds. So when people eat raw and undercooked poultry, there's a possibility of infection. Similarly, cows are common carriers, so people that drink unpasteurized milk can also risk infection. There's also direct contact with infected pets, notably puppies, which excrete the bacteria in their stool. Kids are the most susceptible to getting infected after playing with an infected pet. Lastly, infected stool can end up in sources of fresh water, like rivers, and cause infection. Once inside our body, Campylobacter jejuni has a number of virulence factors that it can use to attach to host cells and cause disease. First, it has fimbriae-like filaments and cell surface proteins like PEB1 and CADF that help it attach to the mucosa of the small intestine and colon. There, Campylobacter jejuni uses its spiral shape and long flagella to drill into the mucosa where they release toxins called cytolethal distending toxins. These toxins damage nearby intestinal epithelial cells, further worsening the inflammation. When the inflammation and damage become pretty extensive, the colon might dilate, resulting in toxic megacolon. The bacteria can also keep drilling until they reach the bloodstream, causing bacteremia. The immune system may react to the presence of bacteria in the blood by making anti-ganglioside antibodies, which attack the peripheral nerves, causing Guillain-Barré syndrome, a type of paralysis. Similarly, the infection can also cause an autoimmune inflammatory reaction, where immune cells attack the joints in a condition called reactive arthritis. Symptoms usually show up after a 1 to 7 day incubation period. Typically, people have symptoms like fever, muscle pain, malaise, and headache, which are followed by crampy abdominal pain and diarrhea that is watery and ill-smelling at first and then turns bloody. Bloody diarrhea is more commonly seen in children. Additional symptoms may appear with complications. With toxic megacolon, there's bloating, tachycardia, and possible loss of bowel sounds on physical examination. With Guillain-Barré syndrome, there's ascending paralysis, meaning it starts at the feet and then extends to the upper body. Campylobacter jejuni infection is actually one of the most common bacterial causes of Guillain-Barré syndrome. Lastly, with reactive arthritis, there's pain in large joints. Campylobacter jejuni infection is diagnosed based on clinical manifestations plus direct examination of a stool sample, which shows gram-negative, comma-shaped bacteria and also white and red blood cells in the stool, or by isolating the bacteria on cultures. Now, since the infection usually resolves on its own, treatment usually relies on hydration and correcting any electrolyte imbalances that may occur as a result of diarrhea and vomiting. With severe infection, antibiotics like erythromycin can be used. Finally, means for preventing transmission in humans are hand washing, thoroughly cooking meat, especially poultry, keeping raw meat, specifically poultry, separate from other foods, and lastly, don't drink raw or unpasteurized milk. Alright, as a quick recap, Campylobacter jejuni is a comma-shaped, gram-negative, oxidase-positive bacteria found mostly in poultry and unpasteurized milk. It grows best on Skiro, Butzler, and Campylobacter blood agars at 42 degrees Celsius in low oxygen environments. It's responsible for causing gastroenteritis, and symptoms include bloody diarrhea, fever, crampy abdominal pain, and vomiting. Some worthy complications to mention are toxic megacolon, Guillain-Barré syndrome, and reactive arthritis.